So next up is thyroid deficiency. So marking all the symptoms that you have. So, and you'll see on some of these, I've got them asterisked because these are actually especially significant. As I mentioned on that first page with the instructions, ones with asterisks are especially significant. So for thyroid, these are the symptoms: fatigue, cold extremities, so cold hands, cold feet, memory loss, hair loss, lower leg swelling, constipation, dry skin and hair, brittle nails, weight gain or difficulty losing weight, and then there's some lab work on here: elevated blood sugar or diabetes, elevated cholesterol, elevated blood pressure, depression and anxiety, heart palpitations or arrhythmias, poor cognition or brain fog. So those are signs and symptoms. And then the laboratory test to do to evaluate the thyroid is the FYF blood panel or the male or female hormone panel, which is that blood spot test. And just as an aside, the way that this works is that once you purchase it from my partner's site, then you will get a lab order if it is the blood test, and you print that order out. It comes to your email, you print it out, and then you take that and you go to your nearest lab. LabCorp or Quest are some of the big ones. And then the male-female hormone panel, the blood spot test, that one comes in the mail as a kit. You basically just prick your finger and do the test that way. So, and then here's the results. So the laboratory data is a thyroid level, a TSH level of greater than 1.5, and then a free T4 level of less than 1.2, a free T3 level of of less than 3.0. And we'll go more into these when we do more education on these individual sections. But once you have this packet, then when I go through more of the training, you're going to understand more about how all of these different causes work together, and more about the background and more details on some of the nuances to the laboratory data. And then thyroid antibodies elevated per reference range of the lab, and then elevated cholesterol and other cardiovascular markers on blood testing. As you've heard, if you've heard me speak before about thyroid, the #1 anti-hypertensive, so basically blood pressure lowering medication as well as cholesterol lowering medication that I have found is thyroid. And then blood sugars will also come down when you optimize thyroid function. So blood sugars will be elevated. Heart strain markers, so a precursor to congestive heart failure, will be greatly improved by optimizing thyroid. And then elevated inflammatory markers on blood testing as well. So then here's education. In my experience, it is very likely that someone has thyroid deficiency if they have 3 or more of the above symptoms. This can be corroborated by a high TSH and low free T4 and free T3 levels. The other laboratory tests are confirmatory but not required. So when TSH, I'm going to scroll back up here. So when TSH is above 1.5, it basically indicates that the brain is yelling at the thyroid to make more thyroid. And then you can see if that corresponds with lower levels of the free T4 and the free T3. These are the bioactive, bioavailable forms of thyroid, the free fractions. And so usually they corroborate. If they don't, where let's say the TSH looks fine, but the free T4 and the free T3 are low, that indicates that the thyroid is in fact low, but there's something else going on where the brain is not communicating properly with the thyroid. So then here's the conclusion. So yes, I believe I have this cause. So you would mark that off. Go back up to page 2 and mark off thyroid on that.